Acne treatment products. When talking about skin problems, 9 times out of 10 you will discover that the topic is acne. Acne is one of the most common skin conditions, mostly in teens but also with adults. Acne can prove to be a very serious problem. One of the products that have been swiping the markets is acne soap. Almost every cosmetics and dermatology company that respects itself has some kind of acne soap out there for the public to use. Many soaps may cause irritation to some of its users. Some soaps are scented and some users are irritated by them too. These anti-acne soaps come in 2 different forms, in liquid or in classic bar shape. Most of the soaps have a similar version in bar or liquid, so it is really the preference of the user if he or she likes this form or the other better. Cleansers are used to fight and remove oil and dirt from the surface of the face, thus cleaning and opening it. This is not a one-step procedure. The cleaning is a first step, allowing the active topical acne cleaner to treat the acne and decrease it. One major problem with teens using these soap and anti-acne treatments is that they are too eager to eliminate their acne that they overuse the products. This may cause other problems, as the use of soap on the face skin creates dryness and irritation. In this case, there should be a regular and steady use of the treatment products, and not an acne blitz to try and eliminate acne immediately. This simply does not work. Another important factor is the kind of skin the user has. It is important to know and understand what kind of skin you have before you even buy your acne treatment products, soaps or cleansers. Dry or oily skin require a product that will treat the face skin accordingly, otherwise the user may make his problem worse than better. This is very important, and this should not be left for the salesperson to de-iced. Users with dry skin should gentle cleansers and soaps, as they will feel an aggressive one immediately and it would not help their condition. Synthetic detergents are sometimes recommended for dry skin. They should not be used often and have been known to work well on that skin type. One skin type that needs to be most careful of all is a sensitive skin type. If you have sensitive skin, you should be very careful with what you use. Try and make sure well in advance that the product is frost-sensitive skin and that it will not hurt your skin face. Try not to use any products that require scrubbing or aggressive washing. Look for gentle soaps and liquids, cleansers and special sensitive skin products. It is important to know what you are shopping for and what kind of skin you have, before you even go out to the shop. You should put some thought into the acne treatment that you are going to use, and think about a long-term fight against acne and not a one-day effort. Find a product you like and that is good for you, and use it every couple of days. Always read the instructions and use common sense when looking for new products. Acne treatment product information. Recent studies have concluded approximately 90% of all teenagers, 50% of all adult women and 25% of all adults had suffered from acne, either as a chronic skin disease or at some point in their lives. Although there's no universal cure, acne is definitely easier to treat now than it used to be. However, finding the right acne treatment product is still a mystery for many of the sufferers. Despite all the scientific knowledge today, people still think that acne is caused by particular things we do. Actually, it is mostly a combination of factors underneath our skin that lead to acne. The good news that there are acne treatment products that can eliminate it completely in about 95% of all cases. Your skin has many wonderful features that help it recover completely even from serious acne if treated properly. It is self-healing. It is very elastic. It registers and remembers sensations very precisely. It is very resilient. It is self-cleaning and hardly ever suffers any serious infection. It lets in some elements and protects you from others. It holds in the entire amount of liquid that flows through your body. Salicylic acid. There's a lot of evidence that salicylic acid is one of the most effective approach on acne problems. It decreases the number of primary acne lesions, as well as the number and severity of all lesions associated with acne. Salicylic acid is safe to use even on dark skin and gives good and fast results. Glycolic acid. Among popular alpha-hydroxyl acids, glycolic acid is one of the most commonly used. It has similar results with a chemical peel. Even when used in strong concentrations, glycolic acid has only few negative side effects. Long-term day-to-day use may also have a beneficial effect on acne scars. Glycolic acid is also effective in increasing skin resistance to ultraviolet light, improving moisture retention, as well as the general skin condition. However, even though it is quite effective and has only minor side effects, it is better to use as part of a more complex skin care system. Benzoyl peroxide. Benzoyl peroxide is a widely used ingredient in acne treatment products. It used to be very popular in the 1930s, but since then, medical science has come up with new and more effective treatments. However, many dermatologists are still pleading for the benefits of acne treatment products that contain benzoyl peroxide. In addition to its antibacterial effect, benzoyl peroxide apparently has an antioxidant action as well. Among its most common side effects is dry and irritated skin. Many acne treatment products available on the market today use one of the ingredients mentioned above in combination with other ingredients. Some of the most famous and effective products against acne are Pro-Acreve, Zenmed Derma Cleanse System, Accutane and benzoyl peroxide. However, when purchasing an acne treatment product, you have to look through the side effects thoroughly, as some of them may be worse than your acne itself. Acne treatment, benzoyl peroxide. Benzoyl peroxide is one of the common ingredients used to treat acne. You can find this active ingredient in the form of a cream, gel, lotion, face mask, or cleansing bar. Benzoyl peroxide is very effective in treating mild cases of acne. This acne treatment drug is available in non-prescription form for concentrations of 2.5%, 5% and 10%. If you are looking for concentrations higher than 10%, you need a doctor's prescription. Several studies have shown that 2.5% benzoyl peroxide is equally effective to combat pimples and is less irritating. Therefore, if you want to try benzoyl peroxide to treat your acne, you should begin with a low concentration, example 2.5% benzoyl peroxide. Number 1. How benzoyl peroxide works. Before we go into details on how benzoyl peroxide can prevent acne, it is useful to understand how acne is formed. Propionibacterium acnes is a bacteria that causes the skin disorder acne. P. acnes is a major inhabitant of human skin and is the causative agent of acne. This skin-dwelling organism will multiply rapidly within clogged sebaceous follicles if left untreated. Fortunately, these bacteria cannot live in the presence of oxygen. Benzoyl peroxide is an oxygen-releasing chemical in the organic peroxide family. Upon applying on the affected area, this chemical is absorbed into the pores and releases the oxygen to destroy P. acnes. Number 2. Side effects of benzoyl peroxide. It is important to note that there are some side effects when using this anti-acne medication. A. Dryness. If you are using 5% or 10% of benzoyl peroxide, you may want to try a lower concentration, say 2.5% of benzoyl peroxide. B. Irritation. For irritation, you can reduce the usage frequency. If you encounter severe irritation even the usage frequency is low, you should discontinue using the product. C. Allergy. If you are allergic to benzoyl peroxide, you should discontinue using it and consult your dermatologist for other acne treatments. D. Bleach. Benzoyl peroxide is a powerful bleaching agent. You should prevent your hair from contacting this bleaching agent as this medicine can cause permanent color dampening. Before using benzoyl peroxide for your acne treatment, please take note that this medicine generates free radicals in the skin. The result is redness of the skin due to oxidative stress. The effect is similar to unprotected sun exposure. If you are using a benzoyl peroxide product to treat your acne, you should avoid unnecessary sun exposure and use a sunscreen during the day. Please be reminded that the above information is for informational purposes only and it is not intended to replace any health care services you need. The information provided is strictly not meant to diagnose medical conditions, offer medical advice, or endorse specific products or services. Do not rely upon the information provided alone for medical diagnosis or treatment. Kindly consult your doctor about any personal health concerns. Acne treatment. Isotretinoin. What is isotretinoin? Isotretinoin is a retinoid. That means that it is derived from vitamin A. The chemical name of isotretinoin is 13-cis-retinoic acid. Isotretinoin is a very effective drug for acne. It is normally prescribed for severe acne when other therapies fail. Isotretinoin should be taken very carefully because it can produce birth defects in fetus. While taking isotretinoin, you should be always in contact with your doctor and report any side effect. You should also discuss about any possible pregnancy with your doctor if you are sexually active. Isotretinoin generally gives relief in severe acne and is a drug of choice for acne patients who may have lost hope about cure of their acne. Prescription. Isotretinoin is prescribed for acne treatment. Isotretinoin works in treating acne by shrinking the sebaceous glands and reducing sebum production. Isotretinoin is anti-inflammatory and removes comedones. The treated skin is dry and inhibits the growth of acne bacteria. Isotretinoin is prescribed in case of severe acne, scarring acne, moderate acne that is not responding to other medication and every case of acne where doctor feels that isotretinoin should be prescribed to get rid of acne. Isotretinoin may also be used for some other conditions that include folliculitis, seborrhea, chloracne and other diseases that look like acne. The dosage of isotretinoin will depend upon the severity of acne, body weight, other treatments being used at the same time etc. Your doctor is the best person to decide about the dose. Normally the treatment begins with small dose and as body adjusts to isotretinoin the dose is increased. Doctors also monitor the cure during this period and if they find that patient is not responding, they may stop the therapy. As isotretinoin needs fat to help its absorption in body, it is taken after food. Please follow your doctor's advice about these. Side effects. The common side effects of isotretinoin are dry mouth, dry nose, thinning of hair, fatigue, dry skin, red itchy eyes, sore lips etc. If you experience any other side effects such as muscle aches, difficult walking, depression, vomiting etc., please talk to your doctor immediately. Please discuss about side effects with your doctor before beginning of the treatment with isotretinoin and report any expected or unexpected side effect immediately. Please note that you may not be able to wear your contact lenses for some time in the beginning of treatment with isotretinoin. You are also not supposed to donate any blood while you are taking isotretinoin and for 1 month after you stop taking it. Please talk about dose and do not with your doctor. You also must tell your doctor about any medicine or vitamins that you are taking. You are not supposed to take any medicines without consulting your doctor while taking isotretinoin. Isotretinoin and pregnancy. Isotretinoin can cause serious defects in the fetus. Therefore, you should inform your doctor if you are pregnant. You should also tell your doctor if you plan to become pregnant or breastfeeding. You have to test yourself for pregnancy before you begin isotretinoin and continue getting tested while taking isotretinoin. Your doctor will explain the details to you. If you get pregnant while taking isotretinoin, you should stop taking it and call your doctor immediately. You must adopt 2 reliable methods of birth control for 1 month before taking isotretinoin, continue while taking isotretinoin until after 1 month of stopping isotretinoin. You should talk to your gynecologist and dermatologist in detail before taking isotretinoin. This video is only for informative purposes. This video is not intended to be a medical advice and it is not a substitute for professional medical advice. Please consult your doctor for your medical concerns. Please follow any tip given in this article only after consulting your doctor. The author is not liable for any outcome or damage resulting from information obtained from this video.